All patients should plan on being with us for 3 days and 2 nights. The consultation is the first day, surgery the second day, and the postoperative exam is the third day. We offer surgery 4 days a week, Monday through Thursday. We do not offer reversal surgery on Fridays or weekends. Mondays are slightly different because we do the consultation and surgery all on the same day. Mondays can seem a little more rushed because we are having the consultation and surgery on the same day. Patients who travel from the West Coast or internationally prefer surgeries on Mondays because it gives them more time to travel over the weekend. The first day is the consultation appointment. It is important that patients plan their arrival in Raleigh before 12 noon because we don't want them to be late for their consultation. Consultation appointments start at 2 p.m. When patients arrive for their consultation, they are checked in by our front desk staff. The nurse will meet them, obtain their vital signs, and will officially calculate their body mass index. It is important their body mass index be below our maximal limit on the day of consultation. After calculating the patient's body mass index, the nurse reviews our pregnancy management protocol and answers questions patients have about surgery. After meeting with the nurse, patients meet with me, Dr. Monteith. I explain the surgery and what will be done. I will answer any remaining questions patients have about surgery. I will also provide written prescriptions for pain and nausea medications to take after surgery. I will then perform a brief exam and show the patient where the incision will be made during the surgery. After the consultation, patients and their responsible adults are free to check into the hotel, get their prescriptions filled, and have a big dinner. I even encourage patients to have a little wine or beer to celebrate the event. We ask patients to stop eating and drinking starting midnight before surgery. Surgery is scheduled on the day after the consultation. On the second day, patients return to our facility. The nurse will check them in, get them changed into a gown, and start their IV. Patients meet with our anesthesia staff immediately before surgery. I like to tell patients, although surgery seems like the scariest part, it usually is the easiest part. All surgeries are done under general anesthesia. You simply close your eyes, and when you open them, you're done. Most surgeries take 1 to 2 hours. We use a long-acting anesthetic medication in the incision, and most patients are comfortable when they wake up from surgery. The operating room staff will transfer the patient to the recovery room, and I will meet with the responsible adult in the waiting room. In the recovery room, we make sure patients are as comfortable as possible, and we then bring their responsible adult to the recovery room to be with them. I then meet with both the patients and their responsible adult in the recovery room. The nurse will review the immediate postoperative instructions. Most patients spend less than an hour in the recovery room. We discharge patients to the hotel for recovery. All patients will receive my cell phone number to call in case of an emergency. I ask patients to only drink liquids for the first 6 hours after surgery. After 6 hours has passed, they may then eat any solid foods they desire. We encourage patients to get up and walk the night after surgery. Some patients even feel good enough to go out to dinner. We ask patients to return for their postoperative evaluations in the morning after surgery. They should not make arrangements to leave Raleigh until after 12 noon. During the postoperative evaluation, the nurse will remove the patient's bandage, clean their incision, and place a fresh bandage. The nurse will also review all of our postoperative care instructions. I also meet with patients during the postoperative evaluation. If they are having any discomfort, we can review their pain medication plan or change the pain medication if required. I review the surgical findings with the patient and I answer any questions they may have. I also provide the patient with a copy of their operative report and a letter with my recommendations. All patients will be contacted by a member of our nursing staff within 24 to 72 hours after surgery, and all patients will have my cell phone number in case of an emergency. Most patients return home after the postoperative evaluation. We encourage patients to follow up with their primary care doctors within 6 weeks of having surgery at our office so they can discuss getting pregnant and also the early pregnancy management protocol.